Okay, I believe it's recording. Hello, I'm Cassidy. This is my partner Daisy. Today, let me start the slideshow. Today for our Sentinel event project, we were given the opportunity to dive into aspirating on a foreign object. But before we go into the information that we gathered, I want to go over a few things about what a Sentinel event is and what aspirating is, and what this all entails. So what is a sentinel event? A sentinel event is an unexpected occurrence involving death or serious physical or psychological injury or the risk of thereof. So today let's go into the causes of sentinel events related to aspiration on a foreign object. It is important to know that a foreign object can be anything that isn't already supposed to be there. So it could be anything such as partial dentures, small objects like buttons or small toys, commonly for children, and can even be some objects or aspects of food that may be missed, like a chicken bone or anything of the sort. So those are all foreign objects to the body. So when we're talking about aspiration, we're on a foreign object, we're talking about anything that's not already supposed to be in there, that's foreign to our bodies. So in this case, some causes of the sentinel event related directly to aspiration could be not properly, can be someone that's not being properly educated on dysphagia or choking precautions, someone not having proper precautions on what surrounds patients. So if you know a patient is a high aspiration risk, you want to make sure that your staff or the loved ones of the patients are they understand what that entails. So they're keeping a close eye on them, they're being monitored, they're being supervised while they're eating, and following proper diet orders. A lot of patients who are aspiration risk do have a lot of common diet orders such as mechanical soft or pureed. So it is important to follow the diet orders according to the patient's restrictions.
To know what happens during aspiration, it's important to know what aspiration is. Aspiration is essentially choking. Choking is typically defined as an aerodigestive foreign body causing various amount of obstruction to the airway. The obstruction can lead to difficulties with ventilation and oxygen, resulting in significant mortality. In severe cases, mortality is caused by brain injury and less commonly pulmonary hemorrhage. In adults, foreign body aspiration is much less common than with children, and is often due to intoxication, general anesthesia, neurological conditions, or sedation, and is often tolerated for much longer than it is in children, but is just as life-threatening in adults than it is in children too. There is a diagnostic challenge when trying to take a history from a patient who may have aspirated or inhaled their dentures. Many patients may not recall that they have aspirated them, and the dentures, plate, and teeth are making the identification on imaging much more difficult. Patients may have coexistent disease, and this may delay further investigation. The difficulty in identifying the denture plate and teeth are exactly why we selected dentures in the event of aspiration. The way we can help spread awareness on how easy it is these sentinel events to take place, but how easier to prevent them.
So for our project, we did have a narrative. This is the storyline that we chose. We're not going to dive too much into it, but it is right there. This storyline basically goes over a real life scenario that we instructed ourselves, that lays out how easy it is for this sort of event to happen, but it is easier to prevent an event like this from happening. So going into some statistics, before going into how to prevent this, it is important to know the prevalence of this event. So statistically, it's shown in the United States, It was estimated over 5,000 deaths occur annually due to choking related incidents, which can include aspiration of foreign objects. That's a lot of people to consider, knowing that in most cases with the proper teaching, it may have been a preventable situation or it could have been prevented. When it comes to high risk choking, infants and children under 3 years old are at the higher risk of aspiration due to their natural tendency of putting things into their mouth when they're exploring new objects. Although pediatric patients account for a significant portion of aspiration cases, with infants and toddlers being particularly vulnerable, older adults, especially those with dysphagia or swallowing difficulties, are also at an increased risk.
Out of 138 patients who underwent a procedure to retrieve the object was being aspirated on, 65.9 were men between the ages of 29 and 87, and 43.5 had a history of definite choking previously. The most common type of aspirated foreign body was teeth, which was 37.7, followed by chicken bone, which is 15.2, nuts were 14.5, and fish bone was 9.4. Foreign body aspiration is not rare, even in adults who do not have predisposing factors. Events occurred for about 40% of all cases of foreign body aspiration. And then our real life example one is a 30-year-old patient was getting ready to have surgery, but denied having dentures or any partial dentures during her pre-procedure history. It was discovered that she had dentures during the procedure when she had a partial obstruction caused by the dislodge of her partial dentures. It is important not only to ask a patient about the use of dentures, but to also physically check as well.
So for the second real life example, we do have a COPD patient. A 65-year-old man was referred to a respiratory clinic with recurrent chest infection with a background of chronic COPD. Upon further investigation and some imaging, they noticed a hard mass when they did multiple biopsies, ultimately leading to them to complete a bronchoscopy, finding and removing a set of dentures from his airway.
There are solutions to prevent this from happening. There are many components to help prevent aspiration from happening inside healthcare facilities and at home. For example, in nursing facilities, each nursing station should have a diet binder that can be accessible to staff members that are regularly updated with patient diet orders and restrictions. If staff members are unsure with what diet order restrictions mean, it's important to educate the staff by holding an in-service for them, especially hosting and attending an in-service for aspiration precautions patients as well. It's also important to complete inventory sheets and complete the full patient assessment upon admission to healthcare facilities, ensuring that there is nothing missing, such as partial dentures. For patients at home, you can educate family members and visitors on proper diet order and restrictions. This can happen in forms of care plan meetings, so family members can have the opportunity to ask questions and gain further clarification if needed. You want them to understand the importance of following a diet order and restrictions and monitor outside of foods or items coming in for loved ones. Solutions to prevent this from happening. There are additional ways to prevent a patient from aspirating, such as proper oral hygiene and mouth care, especially in patients with dentures. Dental care with dentures is incredibly important, not only because they are a host to introduce food and bacteria, but because they can wear down over time and their fit may change. Another way of prevention is to have a staff member monitor residents besides table for small objects that they may attempt to eat.
So additional ways of prevention in the hospital setting, particularly when it comes for meal times with your patients, there are several things to keep in mind and consider. So first, you want to make sure that the patients are sitting upright for their meal times if tolerable. You don't want to rush meal times. If they are able to get up in their chair or go to the dining hall with other residents, that is highly encouraged. But if it's not in their weight-bearing status, or if they aren't able to tolerate it, sitting up at the edge of their bed during meal times would also help. You don't want to rush meal times, so you want to give enough time for them to chew, take drinks in between food if needed. And also don't give large spoonfuls of food. If they can eat by themselves, do encourage it. You can always excuse me, you can always assist when needed. But if if the patient is a feeder and they are a high risk of aspirating, then you do want to have additional supervision and have the patient or have the CNA feed the patient, but on their own time. So you want to inform a speech therapist when a patient is needing a swallowing assessment. So sometimes patients can be given a regular texture coming from the hospital into a skilled nursing facility, but they might prefer or need a softer diet, such as mechanical soft or pureed diets. If you believe your patient's having a difficult time tolerating a certain texture, it's important to know the warning signs that could indicate them to move down a texture. So if they're eating and they're coughing, if they're having a hard time getting the rest of their food down their esophagus, or if they're just slightly choking, maybe that is an indication to inform the MD or the doctor to get a speech therapist evaluation. That way they can see if the patient does need to be reevaluated and moved down textures.
Okay, so now we're going to go through some discussion questions. So picture this, you're in a healthcare facility and everything seems routine, but suddenly something goes wrong. A patient, just like any other, experiences a life-threatening incident and nobody anticipated. We're going to explore why these incidents occur and how we can prevent them. One of the biggest things is lack of education on dysphagia and choking precautions. One of the primary causes is a lack of proper education among healthcare professionals on dysphagia and choking precautions. Dysphagia is a condition where patients struggle with swallowing, increasing the risk of choking and aspiration. Now think about it. Many healthcare professionals, especially those newer to the field, may not have received comprehensive training in how to recognize dysphagia and put choking precautions into practice
Effectively. When this knowledge gap exists, it can lead to healthcare workers failing to identify patients at risk. And as a result, they might not be able to take the necessary preventative measures. This is why it's crucial for healthcare providers and professionals to continuously update their skills through training and education.
Lack of proper precautions. Another significant cause is a lack of proper precaution to create safe environment for at-risk patients that include removing potential choking hazards from their surroundings and ensuring that their rooms are free of objects that can pose a risk during mealtime. Just think about it. When these precautions aren't taken serious, accidents can happen. Patient might have come into contact with objects that can be aspirated. Then is where regular room checks and strict safety protocols become essential. Failure to follow diet orders according to patient conditions or restrictions. Now let's talk about dietary orders. Imagine a scenario where physicians prescribe specific diets based on the patient's health condition, including the risk of aspiration. But if healthcare providers don't follow these orders, it can have dire consequences. For instance, a patient with dysphagia may require strict dietary restrictions, such as thickened liquids and soft, easily swallowed foods. Deviating from these guidelines can lead to aspiration incidents.
So while a patient's not being supervised while eating, it does leave them at risk during meal times, which can lead to choking and aspiration incidents. So it is absolutely crucial to have constant supervision to ensure patient safety during meal times, especially those with swallowing difficulties. So a lot of the times it is really common, you'll see patients go into the dining hall and have meal times with other patients or other residents, not only for the social aspect, but the more people that are there, it is being supervised. So it's just enhancing those precautions. Also, facilities and hospitals not enforcing proper staff monitoring. So healthcare facilities must enforce staff to monitor their residents. It's not just about following the rules, it is about creating a culture for safety within the healthcare institutions. Regular monitoring, audits, and reporting mechanisms are all part of this. When healthcare organizations prioritize and enforce staff monitoring, They are committed to patient safety. It is about accountability and ensuring that every patient receives the highest level of care.
In a nutshell, these causes highlight the need for education, precaution measures, adhere to dietary order, supervision during meals, and strong commitment to staff monitoring in healthcare settings to prevent aspiration-related sentinel events.
So hopefully this PowerPoint was a little more informational and did help spread awareness on how prevalent this does happen and how easy it is to happen. But it is easier to prevent it. So thank you for your time. Signing off.